Thank you so much for your presentation. And it's clear that with Dr. Holden and Mr. Barra's presentations, that education right now is the most important thing, and that it's clear that not many people know about how bad opioids are, and this education is really important to spreading the word. And it's also so inspirational how Mr. Barra's recovery and full recovery. And it just goes to show that if you are recovering from an opioid addiction, it's clear that there is a light at the end of the tunnel. And although it may be difficult to reach, it is still reachable. So now is the time for the Q&A section of the episode. So I guess I can ask a question, then either of you can respond if you want. So the first question is, what is the best way that we can prevent ourselves from being exposed to opioids?
You want to take that, Doc?
Sure. Well, from the medical point of view, I think that I touched on it a little bit. You need to question if you're getting a medication prescription from your doctor, you need to question what it's for. Do I really need to take it? What are my alternatives? I think from a non-medical point of view is you should never share or accept any medication from anybody, because this is how a lot of people get started, is a medication from a friend. And I think it's important, certainly as a parent, I tell my kids, I know that it's a little bit simple to say, but just say no. But it really is true. You have to learn to say no. And as a parent, it's important to talk to your kids about it ahead of time, because chances are at some point in college or in high school, they're going to be offered narcotics, and they need to be able to say no. It's okay.
And also, to add to that point, the unused medications being left in people's homes, in their medicine cabinets, it's common practice that I get 30 Percocet for a procedure and I only take 2 or 3 if I'm a normal, quote unquote, non-addict personality, and they leave it in the medicine cabinet. Those need to be disposed of, especially if you have children in the home. And that education as well is that most of the time, opioid narcotic pain medication is unnecessary. As Dr. Holden so stated, that it's being prescribed still way, 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 way over the top. And it's unnecessary. So the education is paramount to stopping.
I completely agree. So this question is more directed to you, Mr. Barra. So say someone does become addicted to opioids or any other drug, what should they do to, early on, what steps should they take to maybe curb the addiction?
Well, hopefully with education, people around that person will notice the changes. There will be weight loss. There will be lying. The number one thing we educate doctors' offices on is somebody will not be able to look you in the eye. The guilt and remorse from becoming addicted to something is horrifying, and your behavior will change. This sounds like common sense, but in our experience now, it doesn't seem to be. The denial of a parent of a child, like, not my kid, right? That won't happen to our family. And it is worldwide. I mean, we're focused on New Jersey and our country right now when we're speaking, but the education being paramount. So having a support system, having people to talk to, having people looking out for each other and saying, listen, what's going on, right? Having a conversation, right? And that's what we're doing here. We're just having a conversation about what's going on. And there are thousands of resources now to get help. So an addict in full-blown opioid addiction is so fearful of running out, so fearful of not having the next one, so fearful of getting sick that he won't come for help. So it has to be presented in a way from a family, whether it's an intervention or being led into detox or into treatment. There's every hospital in the state now has resources to get people help. So again, noticing changes in your friend or in your family member and confronting them as soon as possible, early as possible. The earlier you catch this, it's just like any other disease. The earlier you catch it, the easier the treatment is. The more consumption of these things into your body just makes it harder and harder and harder to stop. It is really, I don't know if I can explain so much do it justice, put it into words, how bad the physical manifestation of an opioid addiction is and what it does to your body. It's absolutely incredible how it just takes you over. And another fact I'd like to put out there, when dealing with even alcoholics or drug addicts, when somebody's in full-blown active addiction or active alcoholism, you're not dealing with that person anymore. You're dealing with the disease. They will lie to you. They will cheat you. They will steal from you in order to get the next one. So detox, ultimately rehab, is a period of separation. You have to be physically separated long enough from painkillers to be able to figure out a solution in your life. So rehab and detox is at this point in this epidemic is a necessary thing.
Okay. So Mr. Barra, you mentioned that it's important for those around people who are addicted to recognize the signs of the individual becoming addicted. But how would someone themselves recognize that they themselves are becoming addicted or already are addicted to opioids? What are some signs that you could look into yourself and see, oh, I'm becoming an addict?
Well, if you've taken a 1 week prescription of 5 milligram Percocet or oxycodone, you stop suddenly and you run out of the prescription, and you will have signs of the physical manifestation. You will have some diarrhea, some sweats, maybe some shakes, some mild flu-like symptoms is how it's worded. And at that point, if you have the disease of addiction or the addictive personality, you will want more. Drug-seeking behavior will begin. You will lie for it. You will go back to the doctor. You will say that you need more when you really don't. For the pain, you will lie, saying that you're in pain and then you need more. So that's a first warning sign early on. If this is your first time experiencing opioid pain medication. Now, getting deeper into it, when you don't have it, you get physically ill. And the detoxification process gets harder and harder and harder. The more you have in your system, the longer the use is, and the signs are the sweats and the shakes and the stomach aches and the diarrhea. And if you're full-blown addiction, you will seek more. And that's where the crossover comes to the street drugs. I'm sure in high schools and early college years, everybody at this point is familiar with the availability of heroin and pills on the street. So you will seek to get more. So
I completely agree. Getting nipping the addiction in the bud is really important, and education is one way to help solve that. So getting into more modern times, as Mr. Barra, you mentioned before, how COVID-19 has impacted the opioid users and how addiction is rising and suicide and death rates are rising. But Dr. Holden, how do doctors who are working on the opioid forefront, how are how are they affected in handling the crisis?
Well, I think first of all, you need to have buy-in by physicians, and unfortunately, not all physicians buy into that the problem is that they're part of the problem. And I think really being part of a team, taking a team approach to managing postoperative or any type of pain, a team approach to answering your patient's concerns is very important, and also being educated on the practitioner side. The physicians and the nurse practitioners and physicians assistants need to be educated on addiction, on the signs of addiction, and not be afraid to change the protocols that they've used in the past just because it quote unquote worked for them. But maybe it's not really working for the patient, and you have to be willing to change your protocol to do what's best for the patient and best for society. And I think really the New Jersey, it's called PMP, New Jersey Pharmacy Monitoring Program, which every state has. You really are supposed to look at that before you give a prescription. You're supposed to put the patient's information in and look to see if they've gotten any other narcotics, and if they have, what they've gotten, and then you can certainly question them on why they've gotten these other narcotics. And it just really, everybody has to really be a watchdog, because once the patient is addicted, they're not going to initially be willing to try to get off of it, because they physically can't get off of it. And, they a lot of times don't know what to do to get help. And our job is to look for these signs and to point them in the right direction.
So thank you both for joining me today. So as mentioned by both Dr. Holden and Mr. Barra, the opioid epidemic is rampant and is in the forefront of health policy. I would like to thank both doctors for sharing their valuable knowledge and experience. And I would also like to thank Raiyaan Shaik for recording this podcast and helping develop the questions, as well as Eli Engler for editing.